Thank you for watching my video tutorial. We begin by advising your patient to firmly place his or her feet flat on the ground surface, followed by making sure the upper arm has nothing obstructing from taking a bare arm measurement. Patient will sit calmly for 5 minutes and should abstain from smoking or drinking caffeine at least 30 minutes before the first measurement. The proper materials for taking a blood pressure assessment requires a sphygmomanometer, which encompasses a cuff with its bladder, a bulb and valve, and a gauge that will require you to read the units in millimeters of mercury. As important, also required, is a stethoscope that will allow you to listen to the Korsakoff sounds, which are very critical to understanding blood pressure sounds. After the 5-minute rest and making sure your patient is still properly seated with his/her back properly supported on the chair and arm is rested on table at heart level, we begin to check that we have chosen the proper cuff size for our patient's arm size. The inflatable part of the blood pressure cuff should cover about 80% of the circumference of your upper arm, and the cuff should cover 2/3 of the distance from your elbow to shoulder. Palpate the brachial artery located mostly medial of the antecubital space and align the artery mark shown on the cuff. Next, insert the leads of the stethoscope into your ears with the ear prongs facing forward and lightly tap on the bell, ensuring proper hearing function. Place bell over brachial artery. Turn valve located on the bulb all the way to the right and begin to inflate the bulb to 180 millimeters of mercury or 20 millimeters of mercury above the first Korsakoff sound, making sure also not to place the bell under the cuff and also making sure your fingers are rested around the bell so not to produce accidental noise interference that can disrupt taking proper readings. Once proper inflation has been reached, begin to turn the valve to the left to quickly release and depressurize the cuff at a rate of 2 to 5 millimeters per mercury per second, waiting to hear the first of 2 or more Korsakoff sounds, the first sound being your systolic blood pressure reading. The first sound is described as a thump thump and will continue to be heard as such to the point before the disappearance of the Korsakoff sounds, at which point that will be your diastolic blood pressure reading. Once the readings are recorded of your first measurement, an additional measurement should be made with a minimum of 1 minute apart, and the average should be taken of the two. Remember to provide your patients verbally and in writing their specific blood pressure numbers so they can reach their cardiovascular health goals.